Dear colleagues, dear students, dear interested participants, welcome to the MOOC on an introduction to oral radiology. My name is Michael Bornstein and I'm professor in oral and maxillofacial radiology at the Faculty of Dentistry at HKU. I want to get you interested in my research topic, but also practice that I do daily when treating patients. So we have to ask ourselves in the beginning, why do we need radiology in dental medicine? What is the position of dental radiology in dental medicine? Well, first of all, if we treat patients, or even so before we treat patients, we see the patients and we need to have a dental and medical history, which has to be quite inclusive because patients get older and have more and more risks. Following the medical and dental history, we do an intraoral and extraoral examination. This is the basis then for deciding which radiographic imaging modality we're going to use for this patient. Here you have two examples, an intraoral radiograph and an extraoral radiograph, which is a panoramic view. Those together, dental history taking, extraoral exam, and the radiographs we take for these patients, they form the basis for a diagnosis. And the diagnosis is central to decide upon a therapy. So you see that for the whole diagnostic process, radiographs and thus all radiology are an integral part of this process. Let's go back to some definitions. Oral radiology actually is called oral and maxillofacial radiology, which is the professional term, OMFR. But for practicability, it's also referred to as oral radiology. Oral radiology includes extra and intraoral radiographic techniques. And I want to show you some and define some of these in more detail. Classical intraoral techniques are periapicals, bite wing, and occlusals. Classical extraoral techniques are panoramic view, cephalometric imaging, but also three-dimensional imaging modalities such as cone beam CT, cone beam computed tomography, and magnetic resonance imaging, MRI. Three-dimensional imaging are also often referred to as advanced dental imaging modalities because basically two-dimensional imaging include intra and extraoral techniques which are normally used in general practices quite frequently. Modern imaging technologies actually are all digital and DICOM compliant. So they actually demonstrate very nicely that we move into a digital area, also within dental medicine. In this slide you see some typical examples. First on the left, on intraoral techniques like occlusals and the periapical, but also on the right side of extraoral imaging modalities such as panoramic view, lateral cephalomograms, which are two-dimensional, and on the far right, an MRI and a CBCT, which are both three-dimensional and thus also termed as advanced dental radiographic imaging modalities. With this short introduction, I hope you have been interested and also motivated to learn more about oral radiology. I thank you very much for your attention and I hope that you will enjoy more MOOCs to come also on this topic.